Namaste to future nurses and health warriors. Welcome to Yaznexaspark. Let's heal and learn together. I'm Yazhini, a nursing tutor from SNS College of Nursing, and today we are going to see about a new topic from the Applied Nutrition and Dietetics. The topic is of additives and adulteration. Let's dive into the topic. Our three goals of learning goals today is of describing the food additives and alterations with the clinical implantations and developing a critical knowledge to raise the food safety and applying this knowledge in the hospitals and OPDs and community centers. And because the food alterations can turn your diabetic patients into an toxic one, so we have to learn about this. The main topic we are the last line of defense. Let's begin with the good. Look closely that the food additives is an intentional and regulated and safety in limits, whereas the adulteration is the illegal harm and product, which means the products are the profit and derived thinkers of additives like medicines and prescribed doses, and which is of benefit adulteration like poison. Even a little can dangers all the patients, and we have to, as the nurses, we have to educate the patients on reading the labels and avoid the state food risk. And let's meet the good additives first. So, what are the food additives? Definition is of substance added intentionally to the food to preserve, that is of like a salt and enhancing the color, flavor. Example turmeric, which is of also the improve textures and stabilize. Like example is stabilizer and regularized by FSSAI and must be on the label with the E number or name, and safety in the ADI, which is of acceptable daily intake. And we have to can say that in clinical link, the therapeutic additives like the tasm gums helps the patient to swallow safely, but excessive can also be harm. So we have to use this in the moderate as a key. Let's meet the four common types. It's of preservatives, that is of sodium benzoate, and stops mold in the jams, and colors like tamarinds, which is of yellow in the candles, and flavors. For example, there is a vanilla and artificial vanilla, the sweetening agents. There are many things like this, and also some allergic reactions can be happen because of that too. So according to the patients, we have to make sure that they can intake or not. This is a common example. There is a preservation is of salt, sugar, and vinegar, which is of flavoring agents and coloring agents and the thickers and emulsifiers. Just look at the image, you can understand here. These are the examples. The preservatives are nothing but keeping the food fresher. That is of prevent the spoilage, and also this can extend the shelter period, like a pickle, and the salt is used in the pickle, and also some in shops they will be using the vinegar as for the pickles. These are the to keep the food as fresh and we can use it further. Colorants and flavorings of it, which ensure that is very colorful, so that attractions can be kept as good, and also the aroma, the smells, and the taste. For that we are using this. The essence they are using, so common in the shopkeepers. Now we are going to for the adulterations. Adulteration is happening in for the three reasons, which is of one is of selling a chalk in a milk, which is of more volume and less cost because of the profit purposes, and the storage. If the mixed stones in the pulses, like during the scarcity, they can give the profit one, the benefits, and the ignorance is of the small vendors unaware of the harmful, which results in the dangers. Yeah, 100 ml milk bottles become 300 ml milk plus 200 ml of water, which is adulterations. The main is of intentionally addition of low quality substance or harmful substance. This is the meaning of adulterations. Already said why adulterations are there, because of the economic benefits and other factors of lack of regulations, and also inadequate testing facilities, and consumers demands for the low cost they need the product. For that, this adulteration is happening day to day. This is an example where they are using the day-to-day life, they are adulterations. These are the example in spices, milk, and edible oils, and even in honey they are using these adulterations. Adulteration is not just for the bad taste, it's a silent killer. Even the short term effects may keep an nausea, vomiting, diarrhea, allergic reaction, food poisoning. If you're not considering these short term effects, it will be ending into long term complications. We can also use this test, simple test. When we have in homes, we can detect it easily. Kindly refer these books so that in our exam point of view, this may be helpful. Thank you for learning with Yaznexaspark. Like if you will check labels from now and comment even if you found the adulterated food, and subscribe and bell for the therapeutic diet for next videos, and let's heal and learn together. This is Yali signing off. See you in the next video.